Happier City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Because, let me see if this works. Yeah. So we have many uninsured cases, many uninsured people. Then treatment in Thailand is very, very good if you can afford it. Yeah. We have absolutely top-level treatment available here in Thailand, but if you cannot pay for it, it's not for you. And it can absolutely destroy your expat life here in Thailand. So that's why medical insurance is very, very important. So, what are the most common diseases, especially in Thailand? I did a little research, and I found out that heart conditions, cancer, and dengue fever are the 3 most common illnesses in Thailand. And I also found out, and this was quite shocking for me, that cancer and heart conditions account for 50% of all deaths. Cancer and heart conditions account for 50% of all deaths in Thailand. So, this is something to take into consideration if thinking about getting health insurance. So, what benefits can I get from international health insurance? Health insurance covers, of course, emergency and routine healthcare abroad, in this case here in Thailand. It gives you access to the best hospitals, to private healthcare, and to the best doctors and specialists. And you have the choice to choose your area of cover. You can say, okay, I want to only be insured in Thailand. Or you can say, I want to be insured all over Asia. Or you can say, I want to be covered worldwide, but not in the US. Because US is always a little bit tricky. They have their own rules, and there's always almost no way to get coverage for the US. Unless you take out insurance from a US company. So. Then also, I just want to mention this, it has not much to do with what we're talking about today, but there are also special cases or special kind of international insurance. If you have a partner, a Thai partner or whatever, Myanmar partner, and you want to travel to Europe in the Schengen area, they have to apply for a Schengen visa. And for Schengen visa, Thais and other non-European Union or Schengen nationals need a private health insurance as required by European Union law. So if you want to travel to the EU, to Germany, to France, to Switzerland, your spouse or whoever have to apply for health insurance in order to obtain a Schengen visa. Then also, as many of you might know, if you go for a non-OA visa, this is this retirement visa, what you apply for outside country, on some consulate or some embassy outside Thailand. And then you enter Thailand with this. This is a non-OA visa. If you have this, you need medical insurance as required by Thai immigration. And they set certain rules for this. So, what I always hear from people is, oh, I have a travel insurance and I pay a very, very low premium. I want to say something about this. Travel insurances you can take out for up to 5 years in duration. But, and this is the big problem, they might come with a lower premium and this might be okay for now. But whenever your medical insurance has an expiry date, this is the worst you can sign. Because should you get sick, or should something with your health change during this time before expiry, you will never be covered again after this time. So you save now on your long-term travel insurance. Let's assume you get cancer or any other disease, and the travel insurance will sure end after 5 years. because it's just the longest time, the longest duration you can take out in travel insurance. And you have cancer. They will never extend your contract, they will never renew, and nobody else will renew. So stay away from travel insurance, stay away from long-term travel insurance if you are settling abroad, if you want to live here forever. This is not your product. Also, you need, for a long-term travel insurance, it's required you have an address in your home country. Many people have nothing anymore in their home country, and the agent just comes across and say, okay, I give you an address in your home country. Okay, this works as long as you have nothing. But believe me, if you have a case which costs 3 million, 5 million, they will look if you have an address in your home country. And this happened before. So stay away from products like this. That's why the most important point when you take out health insurance is that the company guarantees you that there is no end date and the insurance policy is renewable for life. Very, very important. So what can be covered by international medical insurance? Very, very important. Of course, the coverage always depends on your budget and what you really want. Sure. But there is a certain structure to it. First of it, outpatient. 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 Inpatient. Sorry. Inpatient. Inpatient covers for everything what happens when you get admitted to the hospital. If you have to sleep in the hospital, if you have to stay there, all this is covered by inpatient coverage. Inpatient coverage is the basic of everything. This is the bare minimum you can cover. Inpatient can also include maternity care, especially for younger women. This might be important because there can be complications during the pregnancy, and this can add up to a lot of money. So you should consider this as well. I have a personal experience with that. My daughter was born 2 months early. It was an emergency. It was an emergency case. She was 1.7 kilo. She was born in Bangkok Hospital. She had to go immediately to the ICU. A team of 7 or 8 doctors have been around her 24/7. And the cost for this treatment is 100,000 baht per day. 100,000 baht, this is no joke. I experienced it. And in my beautiful health insurance from Europe, this was not covered. So I never do this again. I just let you know, don't do the same mistake. Just for this. The next service you can add on to inpatient is outpatient. Oops, sorry. In outpatient, outpatient covers your usual doctor visits, everything what doesn't require you to stay in the hospital overnight. This can also be some surgery, which is just be done as a day patient. And also, of course, your medicine, your prescribed medicine, your doctor gives you. This is covered under outpatient. The next thing what you can add on is dental. Of course, a dental examination is required, and if you have some rotten teeth already, of course they will be not covered, but everything else what comes after you take out the dental insurance will be covered. The thing is, and that's why I not really recommend this add-on, is the coverage for this add-on is in most cases very, very low. So we all know dental work is very costly, and if you have to pay a monthly premium or a yearly premium, which is quite high, just to get $1,000 covered per year, it's just not worth it. But it's available. Another module you can add is vision. Vision pays for everything related to your eyes. Let's say you need new glasses, let's say you need contact lenses, let's say you just need a normal, regular eye examination. This is paid by vision. The question is, do you really need this? It's available. So, another point, evacuation. Not so much important for Thailand, but if you would live in Cambodia, for instance, you should really consider it. Evacuation pays for medical treatment which is not available at your location, but really needed. Then the insurance pays the costs to fly you out to the place where you get this treatment, pays for the treatment, and also pay for the cost to bring you back to your place of living. And another point, almost nobody is taking out, is wellness. There are some companies, they also offer a module, what you can add on, which is called wellness. Insurances offer like gym clubs, yoga lessons, whatever helps you to stay fit and healthy. Why they're doing this? Because healthy customers don't cost so much money, of course. What I always recommend is see an insurance really as what it is, as an insurance. And what should we get insurance for? For very high bills. We should really cover extremely high bills. And where we have high bills? In the hospital. Everybody knows that. Go to Bangkok Hospital with some heart condition, boom, $500,000 baht is nothing for 3 or 4 or 5 days. So this you definitely have to get covered. But the question is, do you really need to pay for outpatient care when you see the doctor 2 times a year and have a bill of 2,000 baht? It's really the question, because outpatient costs like 50 to 100% more than only the inpatient plan. And in my opinion, that's absolutely not worth it. That's why I always recommend go for inpatient only. You save a lot of money on the premium and you pay just the outpatient stuff out of your pocket. Makes absolutely sense. For most people, not for all, because, okay, on the contrary, you can also get a condition where you need very expensive medicine. Okay, then of course it can be expensive, it can become very expensive, but it is what it is, we never know. So that's why also, if you have an insurance policy already, please also check if this company pays direct to your hospital. Because the last thing you want to do if you get sick and you need to get admitted is thinking about money, how to pay, whatever, and then they come with this card reader and ask for your card and you have to pay first, and all this stuff you don't want to do. You want to get better. You don't want to think about money. That's why only do business with an insurance who pays the hospital directly. You just show your card, everything is done for you. Very important point. The next issue is, who can be covered? As many of you here know, most of the companies and most of the offers on the market only accept people up to 70, maximum 75 entry age. And this is very sad, because many people are older than this and just think they would have no chance to get covered, which is not true. I come to this in a few minutes. And also the premium is of course very high for people of this age. Premium depends on your entry age, also depends on your pre-existing conditions, what is your medical history, how looks this, and how the policy is paid. Most companies prefer a yearly payment upfront, of course, what they have, right? And most of the companies do not allow monthly payment. And if they allow quarterly payment or semi-annual, then they charge, I have seen, between 5 to 15% interest for this if you're not paid yearly upfront, which is, in my opinion, absolutely ridiculous. And you should not go for this. So what can you do if you have pre-existing conditions? And as older you are, as more likely is the chance that you have some pre-existing conditions and some medical history. Okay, you have to request this case with your insurance company. You have to absolutely 100% honestly answer all medical questions in the application form. And then there are 3 ways how the insurance can treat this or can approach this. First is they exclude your medical condition and say, okay, you are covered, but you have some kidney issues, everything kidney related is not covered, we exclude this. This is the first way they can treat this. The second way is they can say, okay, we put you on a moratorium. Moratorium is a waiting period. They can say 2 years, 3 years, 5 years. And if there is no issue within this time frame, then you are fully covered. It's the second point. Or they can say, we cover you in full, but we increase the premium even further. So these are the most common ways how health insurances deal with pre-existing conditions. Another point, if you have a family, what you really have to think of is, especially in the better plans, in the premium plans, in the plans with a high coverage, many companies not want to cover children, which is ridiculous. Why they not cover my children? I mean, I would never work with a company who does this. But important to know, many companies do not cover children, or if they cover children, then the premium is sometimes higher than the premium for adults. So this is also a no-no. And many insurance companies apply crazy price increases every year. I have seen price increases from sometimes 50%, and the average yearly price increase, if you see the whole market, the entire market, in medical insurance is between 5 and 10%. So you can calculate 5 to 10% yearly price increase in your medical insurance plan. And if you calculate this for 20 years, that's not cheap. So who can be covered? Oh, also important. Many plans have high deductibles. I would also recommend never go for a plan with high deductibles. If you have to be admitted to the hospital, you want them to cover your treatment. You not want to be left with $1,000 or $5,000, or the first $1,000 or first $5,000 you have to pay by yourself, and then they kick in. You don't want to have this. This is also the reality out there, that they say, okay, 30,000 baht is yours, is on you, and then we kick in. Stay away from plans like this. You want to be covered, you want to get coverage when you really need it. Also important, look around you, what hospitals are around you, near you, and if something should happen, where you want to go. Because most of the companies have a hospital network they work with. And in this network, your hospital, the hospital where you want to go, might not be included. So check this carefully, or choose an insurance company where they guarantee you in their terms and conditions that every hospital is covered. It's a big difference if I have only the choice of a hospital network, or if I can go everywhere I want. Also important, many companies here in Thailand force you to, if you take out a medical insurance, also to combine it with a life insurance. This makes sense for Thais, because this might be tax deductible, but for us expats, in most cases, we have nothing out of this. We have no tax to pay in Thailand, so we cannot deduct it from any tax. So I personally would not recommend to combine life insurance with medical insurance, because those two are two completely different products, and you should not combine it. It makes no sense for us, for expats. It makes no sense for people who not have to pay tax in Thailand. The combination, life and medical, they do for tax reasons. But for us, this makes no sense. Then, if you're looking around to get covered, ask yourself first, what amount are you looking for? What do you think is needed for you in case something happens to you? Because what I have seen, I wonder all the time what they do here, everybody knows healthcare is not cheap. But if you see then some offices have big advertising on their windows saying this is our expat retirement plan, which fulfills all the requirements by immigration. Okay. Then you go in this office and you say, show me this plan. Yeah, we cover 3.5 million baht. Okay. Then you read and then you see in the fine print, yes, 3.5 million baht, but per case the maximum is 400,000. What do you want with this? You are not covered 3.5 million. Per case, 400,000. And 400,000 brings you nowhere in an international hospital in Thailand if you have a serious condition. So this is the products many companies sell here in this market. Just doesn't fit the pricing in international hospital. It just doesn't work. And this is the problem. You should really read the fine print. And what I see all the time when I talk to people about this is that most of the people don't know what is the amount they are covered with, and they don't know how much deductibles they have, and all of this. So please read carefully, and also if you talk to an agent, what is reality here also is that they just show you the application form, and they explain a little bit how much does it cost, and then here on the right side, please sign. So, and what most of the people not do, most of the offices here not do, is really asking you for your medical history. And then you pay your premium, mostly around 100,000 baht or something per year. They don't want you to pay semi-annually or monthly, they're not allowed this. You pay your 100,000, and then you pay this for 2 years, and then you get sick. And then you get admitted to the hospital, and then they find out you have pre-existing conditions. Sorry, sir. No payment at all. And what is the insurance doing? It's not like in Europe where you can go against insurance and then you go to the lawyer. The insurance gives you all your money back and say, okay, you didn't answer your questions, the questions about your medical history properly. They don't say our agent did something wrong. They don't say our agent didn't ask you. They don't say that. They just give you all the money back, all the premium you paid, and you get not covered, that's it. So don't do that. Always give your agent or your insurance company 100% information about your medical history. Everything, not only the last 5 years. Okay. Yeah, as I said before, be very aware about the coverage amount. If you ask me how much should I choose, I would say in Thai baht, about 7 million baht for inpatient should be the sweet spot. At least it's for me. This is what I did. Because 7 million baht should really do it. But 1 million doesn't do it. It's just useless. It's not working. So please be aware of that. Okay. But all of this, for all of this, there's a solution. And this is the company I found for myself and for my family a few years ago. What do? They accept people up to 110 years entry age, what nobody else is doing. 70, 75 max on the market. This international insurance, based in the Caribbean, of course not in Thailand, accepts people up to 110 years of age. That means everybody here could apply. Also, which is unique on the market, and why I did this, is it doesn't matter how old you grow, if you have no case, if they not have to pay for you, there's no price increase. So you apply for this insurance, you have your premium, and this premium will never increase if there is no case. And if there is a case, and the insurance paid for you, direct to the hospital, then the next year's price increase is maximum 3%. There's no one on the market who limits your price increase to maximum 3%. The opposite is the case. The average price increase on the market is 5 to 10% every year, even without the case. So this is very remarkable. Also, what they developed is they have micro plans, economy plans, serenity plans, and elite plans. Why? Because there are so many types of customers and customers group that they really try to reach everyone and try to cover everybody. Micro plans, this is something for like developing countries, maybe Myanmar, maybe Cambodia. Micro plans you can cover 1,000, 2,000 or 5,000 US dollar per year. Now this is not much, this is a very low coverage, but the premium for this plans is almost nothing. And if you take into consideration that you can cover yourself with $5,000, which is actually 175,000 baht, and pay almost nothing for it, at least at least you can get admitted to a hospital and get 1, 2, 3 days treatment, or at least if you have an accident, they take you from the road and bring you to the hospital. Better than nothing, right? Okay, economy plans. Economy plans, 10,000, 20,000, 40,000, or $80,000 coverage. This is so for older people or for people who say, okay, I just cannot afford a really, really good coverage. Serenity, covering from $100,000 to $1 million. This is the plan everybody should go for, everything included, even STDs, sexual transmissible diseases like HIV, covered, kidney dialysis covered, which many insurance companies do not cover. Also CT scan covered, what many companies exclude. So there's really a coverage for every budget, and even if you have a big family with 3 or more children, from the 3rd child, all other child are free of charge. No premium from the 3rd child on. Also you can pay yearly, of course, like everybody else, or semi-annually, or quarterly, or monthly. And this without any extra charge. Remarkable, because I told you 5 to 15% extra with every other company. Here monthly payment possible for every plan without any extra charge. Okay, what else we have? Yeah, pre-existing conditions, a very important topic. What they do is really have a very customer-friendly approach toward this. If you have a pre-existing conditions, you just request it with the company, and within 24 hours you will receive an answer telling you how they deal with this. And in most cases the answer is, okay, you can get covered, but there is a waiting period of 2 years or 3 years. This is how they deal with pre-existing conditions. I never have seen that this insurance company rejected someone. So everybody who applied got covered. Never rejected anyone. And also, of course, inpatient claims at the hospital get paid direct to the hospital, and you not have to pay anything out of pocket. We have been, me together with 2-3 other persons, have been to the Bangkok hospital here in Pattaya. We showed them our member cards of this insurance and asked the admin staff if we come with this card, covered by this insurance, even if it's not a Thai insurance, it's an international insurance, if we get covered, if they take us in, and if we have to pay any deposit. The answer was, of course, no problem, and no deposit required. So no problem at all in the Bangkok hospital and any other hospital here. And they cover you in every hospital. No hospital network, every hospital of your choice is covered. And why can they do that? Because they have a very slim structure. No expensive flashy buildings, as you can read, no company cars, no first-class flight for management, no need to keep shareholders happy because there are no shareholders, and that enables them to have a very competitive pricing and coverage. Because what do you think? How much does it cost to run one of these 30-story building skyscrapers in Bangkok? This must be enormous. And all those costs, what do you think, who pays this? Of course the customer have to pay this with his premium. And all this does just not exist with this insurance company.